Craniotomy for brain tumor using Frameless Stereotaxy. Introduction.
Can you point to the abnormal growth in the brain?
Choose one of the following options.
Correct. MRI and CAT scans can always tell whether or not a tumor is benign or malignant.
Select true or false.
Correct. MRI and CAT scans may be helpful, but often cannot show if a tumor is benign or malignant. All brain tumors need to be removed.
Select true or false.
Correct. Using MRIs or CAT scans, neurosurgeons might determine that some tumors are benign. If a tumor does not cause any symptoms, the doctor may recommend observing the tumor instead of removing it by surgery. Are heart attacks and other anesthesia-related complications common during and after brain tumor operations?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the greater the risks. You can do a lot to prevent them. You should make your anesthesiologist aware of any medical problems you may have had in the past, such as heart attacks and lung problems. Paralysis that can last forever or death is possible during or after brain tumor operations.
Select true or false.
Correct. The complications of paralysis or death, as well as blindness, personality changes, speech and understanding problems, and seizures, can happen during or after brain tumor surgery. Blood clots can never happen after brain surgery.
Select true or false.
Correct. Though rare, blood clots can happen, and their results may be life-threatening. Infections are very rare after brain surgery.
Select true or false.
Correct. Infections are indeed rare. However, they can occur. They can be limited to the skin, or they can involve the bone flap, requiring its removal. The infection could also involve the brain itself, requiring long-term antibiotics and possibly another operation. Swelling can explain worsening of the symptoms immediately after brain surgery.
Select true or false.
Correct. Swelling is one of the most common reasons for new weakness a day or two after the operation.
Thank you for using Explain.